Don Williams and Iris Tan again for the Institute of Sports and Spines. Today we're doing a demonstration on some scar release techniques. In Australia we don't have a lot of focus on scars post-operatively, but tight, difficult scars can cause a lot of problems for people, which can affect how their joints recover or how their joints function post-operatively or post-injury. So we're going to show you a couple of basic techniques. So the first technique, we've got a nice scar here to demonstrate with. First technique is doing simple S-bend stretches. So even in the first couple of weeks after surgery, in the first week we don't want to touch scars at all, we want to leave them alone. Once the stitches come out and they start to heal and we don't have scabs, we can start to gently mobilise scars. So we start with things like S-bend stretches. So we're causing opposition of two fingers that cause an S shape to the scar. So we try and stretch in both directions. So this can even be used in the early stages. As people start to improve, we can start doing stretching across the scar, longitudinal stretching. So we stretch long ways and across the scar. And when you're doing this work, you want to look around for little tight spots, little nodules, and they're the bits that we specifically want to focus on. We can also do some pulling, lifting techniques. You want to keep working on the scar once every day or two until the scar works more like the surrounding tissue. So we don't want it to act differently to the surrounding tissue. So as we improve, another technique we can use is some scraping techniques. So we use a little bit of cream. Moisturiser can be fine. I'm using an anti-inflammatory cream, but it's just really as a lubricant, and we use a scraping device. So we have specific tools that we use at Institute of Sports and Spines, but at home the handle of a metal dessert spoon is often a really good profile and a really good size. So we start doing some simple scraping along the scar, and you're looking for areas where it gives a little catch or bump. So we want to try going along the scar and up the scar in both directions and across the scar. You can probably see there on the camera there's a little flick as I go across that. Those little harder nodules are the bits that we want to target. When you start scraping a scar, only work until you see little red dots called petechiae. And once you start getting petechiae, it's time to stop. It shouldn't be terribly painful, but it's a weird feeling. It's an uncomfortable feeling. And once we've given it a little bit of a scrape, then we can give it a rest for a couple of days and start again. So that's a demonstration of scar release techniques. Thanks for watching.